Let's turn to video 2, use of Ginkgo biloba in children and adolescents. Ginkgo leaves have been used for over 4,000 years to treat a whole variety of indications, including asthma, vertigo or dizziness, tinnitus, ringing in the ears. However, Ginkgo may also have a role in the treatment of certain psychiatric illnesses. In terms of mechanism of action, Ginkgo extracts, particularly the flavonoids, terpenoids, and organic acids, are believed to act synergistically as free radical scavengers and antagonists of platelet activating factor. The result of this activity is improved vascular perfusion due to dilatation of arteries and capillaries, a reduction in thrombosis, and a decrease in inflammatory mediators. Potential indications for Ginkgo biloba, ADHD. There are, in fact, several studies which have investigated the use of Ginkgo for the treatment of ADHD in children and adolescents. Results from 2 open-label trials investigating the efficacy of Ginkgo for the treatment of ADHD found that Ginkgo was, in fact, effective in reducing ADHD symptoms after 4 weeks of treatment. An additional open-label trial also found that administration of the maximum daily dose of 240 milligrams of Ginkgo led to improved quality of life measures and reduced ADHD symptoms. However, results from a 6-week randomized controlled trial comparing methylphenidate at doses of 20 to 30 milligrams versus Ginkgo with doses of 80 to 120 milligrams in children with ADHD found that Ginkgo was significantly less effective than methylphenidate for the treatment of ADHD. Results from an additional 6-week randomized controlled trial also found that the combination of Ginkgo and methylphenidate led to a significant improvement in inattention symptoms compared with methylphenidate and placebo, and suggests that Ginkgo, when combined with methylphenidate, may be effective as an adjunctive therapy for the treatment of childhood ADHD. While additional randomized controlled trials are needed to fully elucidate the therapeutic effect and value of the Ginkgo in ADHD, Ginkgo does appear to be well tolerated and may provide a clinically useful alternative for those patients who are unable to tolerate or who are not willing to take methylphenidate or who have incomplete responses to methylphenidate. And this is important because we know that many patients treated with ADHD are partial responders, so the additional benefit given with adjunctive Ginkgo may be very important and helpful. Dosage and administration. Ginkgo is available in the United States in both liquid or solid form for oral ingestion. The typical dosage regimens are 40 milligrams 3 times daily or 80 milligrams twice daily. Preparation should be standardized to the equivalent of the EGB 761 extract, which contains 24% flavone and 6% terpene lactones. Side effects. The good news is that side effects of Ginkgo are generally mild. They include GI upset, nausea, headache, diarrhea, anxiety, and insomnia. Although rare, subarachnoid hemorrhage, subdural hematomas, and intracerebral hemorrhage have been reported in individuals receiving concurrent treatment with anticoagulant medications, likely secondary to Ginkgo's effect on reducing platelet aggregation. Simultaneous treatment with anticoagulant should be avoided, as should treatment in individuals with impairments in blood clotting. Key take-home points here are current evidence suggests that Ginkgo is effective in reducing ADHD symptoms. Although results from a study comparing methylphenidate versus Ginkgo found that Ginkgo was significantly less effective than methylphenidate for the treatment of ADHD, results from an additional study found that Ginkgo, when combined with methylphenidate, may be effective as an adjunctive therapy for the treatment of childhood ADHD. Side effects of Ginkgo are generally mild. Simultaneous treatment with anticoagulants should likely be avoided, as well as treatment in individuals with blood clotting impairments. While additional randomized controlled trials are needed to fully elucidate the therapeutic value of Ginkgo in ADHD, Ginkgo may provide a clinically useful alternative for those patients who are unable to tolerate or who are not willing to take methylphenidate. Addition of Ginkgo may provide additional benefit. For those patients taking methylphenidate who have a partial incomplete response,